Hi, Dr. Larry Altshuler here, back to you about healthcare and healthcare reform. Telling you things that you won't hear from the media and you certainly won't hear from the politicians. Now, speaking of politicians, this is the second of two videos that I'm going to talk about the Republicans and what they think can reform the healthcare system. Now, in the first video, I mentioned three major reform efforts from the Republicans, or what they want. Buying insurance across state lines, getting tax credits, as well as malpractice reform by capping awards and damages. I showed you in that video how none of those three are really going to make any type of dent into the dysfunction of our healthcare system. And in fact, will probably make it worse. Well, there's a few other items I want to talk about in this video. The first one is another more recent but very popular reform with the Republicans, and that is vouchers for Medicare. Now, I'm going to tell you right off the bat, this is a very, very bad idea. And let me tell you why it is. Now, the principle here is that the government will basically give a lump sum money to all Medicare recipients, and then they can use that money to buy healthcare policies from health insurance companies. Well, that should be able to save the government a lot of money, and the estimate is it will. But of course it will save the government money because they're not going to pay very much for these vouchers, and that's going to be a huge problem. But before we get into that, let me just show you one problem right off the bat. This money is going to go to buying insurance policies. Insurance companies, as well as Medicare, are the primary drivers of healthcare inflation, as I have said in many other of my videos. They pay for waste. They pay for unnecessary and ineffective care. So just changing from Medicare to insurance companies isn't going to change the system at all, and this doesn't address the tremendous waste that we have in our system. That's number one. Number two, since the government is going to give money to Medicare recipients, then what's going to happen is that these vouchers are going to be a lot less than the insurance companies are going to be able to provide for them in their policies. Remember, seniors usually have more medical conditions, or they will develop more medical conditions. And because of that, healthcare policies are going to have to be very expansive. These are very expensive. They're going to cost a minimum of $15,000 a year, which is the current price. These vouchers are starting at $9,000. And every year they get less and less relative to the policy because it follows normal inflation. It doesn't follow healthcare inflation, which is a lot higher. So every year the seniors are going to be having to pay more and more out of pocket, more deductibles, more co-pays, and higher premiums. And they're already going to have to do that just from the start, and they get worse every year. This is a real problem because they're not going to be fully covered. In fact, what's going to happen is that seniors are going to be underinsured. And that's a tremendous problem that the Republicans really haven't thought about. And in fact, that's going to be more costly to the government than they really think it is. And let me tell you how. Number one, what happens when you're underinsured? Well, if you have to pay more out of pocket, what's going to happen is you're not going to use as many medical services. You may not take all the drugs that are prescribed to you. Now, you may think that that's unlikely, but in fact, it's happening right now because seniors are very vulnerable. Most of them have fixed incomes. So they already do this. But with this system, they're going to have even less money to deal with. So even more people are going to cut back on services and proper treatment. Well, what does that do? That means that they're going to wait until they're sicker to go get help, to go get medical care. And that's where the problem comes. Because when you wait to get sicker, then medical care is much, much, much more expensive. You end up in the hospital. You end up under catastrophic care. And those are so much more expensive than the primary care and treating you up front. It's not even funny. 1 day in the hospital can cost more than 3 years of outpatient treatment. So by shifting all these people into this category, getting them sicker because they're underinsured, is going to end up costing the government 10 or even more times the amount of money than they would be paying right now without a voucher system. This is a very bad system. It's not going to work. It's going to undercut seniors. They're going to be paying a lot more money. The insurance companies are still going to waste a lot of money. So no one's going to win in this situation. No one. So that is one of the recent major reforms that won't work. Now, let me tell you that right now, of course, we have several Republican candidates for president. Now, the Republicans, whether they're in Congress or running for president, they all are talking about health care reform. They all want to repeal the Affordable Care Act, but they're also talking in generalities. We want to reform Medicare. We need to increase competition. We need to get health information technology. I want to warn you, because these are all generalities. There's no specifics to it. I guarantee you that the Republicans who are talking about this really don't know how to do this. The mechanics aren't there. They haven't figured it out. Competition. We've had competition for 20 years among insurance companies. It hasn't helped anything. How about Medicare reform? We're going to use the vouchers. I just told you the vouchers aren't going to work. I'm telling you that the Republicans are putting all these generalities out. And it's true, we have to reform this and we have to increase competition. But they don't know how to do it. The mechanics aren't there. So you have to be very, very careful about that. Now, before I end this video, I do want to tell you that the Republicans do support one aspect of reform that has a great possibility of working, and that's health savings accounts, HSAs. These are really the only type of insurance policy that really incentivizes people to look at the health care they're getting and to see if it's necessary or unnecessary, if they're wasting their time and their effort and their money. Now, there are some problems with HSAs. Right now, there are certain groups of people that they favor, and there's a lot of restrictions on them that Congress has placed on them. But in the long run, with a few reforms, HSAs can really be saving a lot of money and improving health care. And that is one thing that the Affordable Care Act and the Democrats really don't favor, the Republicans do. So with that in mind, I urge you to go to my website, balancedhealing.com. You'll find all these videos. There's about 15 in all. But you'll also find all this information that will really tell you what's going on and what treatments are effective, what aren't effective, and how to avoid the waste and how to navigate the healthcare system. So until then, thank you for watching this video, and I hope you'll return and see the rest of the video.